Most of us understand the importance of a normal blood glucose level. If our blood glucose level goes very low, we might become unconscious. If our blood glucose level goes very high, we develop a problem called diabetes. Now, diabetes is serious. It can cause damage to the larger blood vessels in our body. So diabetic patients have a very high incidence of heart attack, stroke, as well as amputation. But diabetes can also cause problems to the very small blood vessels in the body, so-called microvascular problems, resulting in damage to the retina. Diabetics have a high incidence of blindness. It can also cause problems with the very small blood vessels supplying the kidney. So diabetics have a high incidence of kidney failure. Now, what exactly is a normal blood glucose level? Well, to put it in terms that most people can understand, including myself, I have here a container with 5 litres of water within it. And the reason I've chosen 5 litres is because the average person has about 5 litres of blood circulating around the body. I have also a container of glucose, a white crystalline powder, and you might be surprised to know that the amount of glucose that I would need to add to this container to give a similar concentration of glucose in my blood is only 1 teaspoon. In fact, it's slightly less. It's about 4.5 grams. So here's the glucose, and if I add that to this container, the concentration in there is approximately the same as the blood glucose level in my blood right now talking to you. Now, if I were to add another teaspoonful, the concentration of glucose now in this water is that of a diabetic. So as you can see, the blood glucose level is very tightly controlled, and the difference between a normal blood glucose and that of a diabetic person is only an additional 1 teaspoonful of glucose. Quite surprising, really. So, how do we maintain normal blood glucose levels during the course of the day? Well, many people are advised to eat small, frequent meals throughout the day, consisting or having as part of that meal or snack a complex carbohydrate which releases glucose very slowly into the bloodstream. However, more recently, many experts have challenged this view, and I'm of the view as well that we don't actually need frequent meals containing complex carbohydrates. In fact, Professor Tim Noakes, in his excellent book, The Real Meal Revolution, has suggested that actually there's no requirement for us to eat carbohydrates at all. And certainly the liver has an amazing ability to manufacture glucose should it be required. Certainly for people with type 2 diabetes, in which the main problem is too much glucose in the bloodstream, many experts, and myself included, believe that the way to tackle this issue is to eat meals which have a restricted amount of carbohydrate within them. Because all carbohydrates, when they're eaten, are digested, and they have to enter the bloodstream as glucose. And as you can see, it doesn't take very much glucose entering the bloodstream to turn a normal blood glucose level into that of a diabetic. So it seems sensible, if you have a risk of diabetes, then to restrict the amount of carbohydrate that you're eating. There's no essential requirement for carbohydrates, in fact. We can exist very happily with proteins and fats. We don't actually need to eat carbohydrates. And as I say, the liver has an ability to manufacture glucose and release it into the bloodstream, a process called gluconeogenesis. So that's a normal blood glucose level. Only 1 teaspoon in 5 litres gives a concentration of glucose which is equivalent to that of a normal person. It doesn't take very much more to tip one into a high blood glucose level, the same as that of a diabetic. And so for those who are at risk of developing type 2 diabetes, in fact, some would say for all of us, it's sensible to restrict the amount of carbohydrates that we eat.